Professor Mags Watson, I understand that you led the team that's just completed the new Cochrane review into pharmacist services for non-hospitalised patients. Do you think you could briefly explain to us the significance of this new review?
Well, we think it's the biggest review of its type that's ever been undertaken. It identified and included 116 randomised trials, so scientific trials, which explored the effect of pharmacist interventions on patient outcome. And for several of the outcomes, it showed really substantial clinically relevant effects or benefits for patients resulting from the pharmacist interventions. So that's the main finding of the review.
So did anything surprise you about the findings?
I think I actually was pleasantly surprised with the outcomes that were of particular clinical relevance, where there was such a large effect. So for HbA1c, a measure of blood sugar, to find that there was such a substantial reduction that could be achieved with the pharmacist services and interventions. So that was really, really encouraging, and it was great. And then also with the effect of the pharmacist interventions on the blood pressure control of hypertensive patients, and seeing such a substantial reduction there as well. So it's meaningful for those individuals, because reductions of that magnitude actually have they have substantial implications for reducing the risk of the consequences of having those type of long-term conditions. So those are the things that surprised me. They're just the magnitude of effect.
And now you've completed the work, would you have any message for commissioners or policymakers based on what you found?
Well, to consider how pharmacists could potentially help to increase capacity within our health system, particularly to care for patients with these long-term conditions. It's definitely something that we should be considering, and I think it is. It's patchy, but we do see it across areas of the UK and beyond. But also importantly, there's implications for people who do the research and evaluate these types of interventions. We do need really clear reporting of what it is they're doing, what they're evaluating, because if we don't know specifically what they're doing, it makes it really difficult to reproduce that in subsequent services to be rolled out. So I think there's implications for policy, for practice, for research.